Welcome back to Politics Nation. On Thursday, Health Secretary Robert F. Kennedy Jr. announced he is reversing a 30-year policy interpretation by restricting undocumented immigrants from accessing the federally funded preschool program Head Start as part of their initiative to make America healthy again. My next guest believes it is morally wrong. I'm joined by Dr. Omer Awan, who teaches at the University of Maryland School of Medicine and is a public health contributor to Forbes. Dr. Awan, you wrote an op-ed about this for MSNBC. Talk to me about what Head Start is and why it is so important for the development of healthy American children.
Well, Head Start is a very critical program that offers really life-saving interventions for many of these children. It offers food, education, health and medical screenings, things like hearing tests, vision tests, developmental tests, things that are critical for them to succeed and to have a chance at life. Remember, Reverend, many of these children are from low-income families. They have very little. So to take this away can have devastating consequences for these children, undocumented children here in America.
Now, immigrant children are about 7 times less likely to enroll in center-based child care, like Head Start, than American-born children, according to a 2019 study by Pew. And according to the National Head Start Association, they have never required documentation of immigration status as a condition for enrollment over the last 60 years. So in line with your thinking about morals, is the cruelty of this policy the point?
Well, it certainly shows their hostility to immigrants. I mean, this is cruel, it's inhumane, and what it does is it dehumanizes these children. What's the message here, Reverend? The message here is that these children are not worthy of fundamental care for health, food, and education. The message here is that they don't get the equal opportunity to succeed and thrive here in America as do other children. Deeply disturbing and deeply concerning, because these are children. We're not even talking about adults. We're talking about vulnerable children who have very little, and this will have economic consequences, public health consequences, and yes, we are losing our moral conscience when we can't even provide basic necessities to children that have absolutely nothing or very little, going forward.
Now, taking this a step further, in the announcement, RFK Jr. said, and I'm quoting, "For too long, the government has diverted hardworking Americans' tax dollars to incentivize illegal immigration. Today's action changes that. It restores integrity to federal social programs, enforces the rule of law, and protects vital resources for the American people." End of quote. But a 2022 study shows undocumented immigrants paid nearly $100 billion in federal and state taxes, contributing more than $25 billion to Social Security, $6.5 billion to Medicare, and nearly $2 billion to unemployment insurance, all services that they are ineligible for and thus unable to benefit from, yet they're investing billions in it. What are your thoughts?
It's absolutely right, Reverend. I mean, when you take a look at that, yes, many of them are paying taxes. And not only that, I think what people don't understand here is that there are so many undocumented children. There's more than 1 million undocumented children in America. More than 5 million have a parent that is undocumented. And many of these children, by the way, are American citizens because they were actually born here in America. Of those 5 million that I just spoke of, more than 4 million are actually born here in America. So what's being done is extremely cruel, and it's just, emphasizing the hostility that the Trump administration has had for immigrants. And I'm afraid that this is what this is all about, and it has much less to do with, the facts and the policy at hand.
Before I let you go, I want to raise this issue with you. Earlier this week, a person died from the pneumonic plague as an Arizona emergency room, though it's not as famous as his cousin bubonic plague. The World Health Association, or World Health Organization, says it is the deadliest plague. The National Institutes of Health say it has not been documented in the United States for more than a century. And NBC News reports measles cases are at the highest they've been in the United States since the country eliminated the disease in 2000. How concerned should the public be with the Department of Health led by a civilian instead of a medical professional and all the unprecedented cuts we're seeing to health care?
Deeply concerned because, first of all, Robert F. Kennedy Jr. is not a scientist. He's an environmental lawyer, and he has displayed a high level of vaccine skepticism, and he has downplayed the importance of vaccines. And we've seen what has happened from measles. Now we have nearly 1,300 measles active cases here in America. 2 children have died, 3 total have died. And this is all because of vaccine hesitancy, because of misinformation, because people are not getting vaccinated. We know that, for example, since you mentioned it, the measles, the MMR vaccine is 97% effective at protecting people against measles if they take it. But the problem is that parents aren't giving their children the vaccine. And now what's happening is we're having disease outbreaks. We're having people die. And, our own leader of public health is not emphasizing the importance of a vaccine. So I fear and I'm scared that more and more outbreaks will happen. More and more people will suffer. And unfortunately, more and more people will die. And some vulnerable children will die because of this rhetoric and these policies.
Dr. Omer Awan, professor at the University of Maryland School of Medicine, thank you very much for being with us.